You are welcome. This session shall be discussing the reconstitution of powdered drugs or the mixing of powdered drugs. Shall be concentrating based on those ones for powdered for injection, and also the calculation of drug dosage based on body weight, because these are interrelated. So what is reconstitution? Reconstitution, this is a process of adding a solvent or a diluent to a powdered medication and then dissolving it to form a solution, which is then administered to a patient to achieve the desired effect. Yes, because these drugs come in powders, and now you can't administer powders, you have to administer solution. And this one is basically drugs are packaged in powdered form to increase their shelf life or time they spend, the expiry date, because these drugs are unstable in water. They have to be used immediately after reconstitution or after mixing. Drugs like artesunate, penicillin, cephalosporin, and steroids. Some common solvents or diluents which are used include water for injection and sodium chloride 0.9% and dextrose 5%. It is important to remember that if you are to use sodium chloride 0.9% and dextrose 5% weight per volume, in the calculation, these concentrations are not supposed to be used. These are not supposed to be used. Don't use this concentration, as shall be continuing in other questions and other calculations, those ones of alligation and dilation and concentration. We shall remind you about this. So, what are the principles of reconstitution? It is important to follow the manufacturer's directions of reconstitution, the type of diluent, the amount and time of reconstitution, because they are the ones who have manufactured the product and they have done tests based on those, and the time required to store the medication. Should it be used within hours or within days? And how to store the reconstituted drug? Can it be put in a refrigerator or somewhere else, or at room temperature in a shelf? Um, Drug packages can come with special dilutes such as artesunate and antrobase. These ones. Always use those diluents in the package and in the order the manufacturer has recommended. If you're supposed to add this diluent first, use that diluent. Don't go against the directions of the manufacturer. And if some diluents are broken, that dose should not be used, especially those ones which come with the unique diluents. And the method of reconstitution is just shaking or agitation by hand. In this one, the solvent is added to the dry powder. Usually, this dry powder are packaged in vials. In vials. So the solvent is added through the rubber, by using a syringe, and then the vial is shaken vigorously to mix the contents. Ensure the contents are mixed very well and there's no powdered contents. Then administer to the patient. These are some of the drug. Here I'm having artesunate pack. In the pack, all these one you can have 60, 30, or 20 milligrams. And in the pack we have 1 ml of sodium bicarbonate, 5%, and 5 ml of sodium chloride, 0.9%. Here they have showed us the direction of use, how they're supposed to be reconstituted. Add this, then step 2, add this. They can even tell you further, if you're going to use it for IV or for IM, how much you're supposed to use for each diluent. So always follow those direction if you're going to reconstitute this medication. Remember, as pharmacy professionals, you have to learn how to cannulate and how to inject. Because if you come to our pharmacies and they ask you, you know how to cannulate, you know how to inject, it says no, then something will be lacking. So this is of Traxone. You can see this 1 gram vial, but supposed to use dry water for injection, and this is the amount supposed to inject the patient or to add there. So always follow these. If you're going to use it for IM, use 3.4 milliliters, and then for IV, sorry, 9.6. Though some people use 10 mils and 4 mils for easier work. For easier work. This is the other one. This is fortified procaine penicillin for injection. You can see they're telling us add 80 mils of water for injection. So the manufacturer has told to add 80 mils. Don't add less or don't add more. Now, why are we studying this one? Because some drugs or some dosages which are given to patients, the strength we don't have it in stock. We have another strength which we use, and then after reconstitution we measure on the amount of drug which contain the dose which I've calculated. Then it's that we administer to the patient. Drug calculations or drug dosage calculation based on body weight. Sometimes the dose is expressed as specific quantity of the drug per unit weight of the patient. For example, here we have milligrams of the drug per kilogram of body weight, mg per kg, or sometimes we have microgram per kilogram body weight. As we saw earlier in posology, that the weight of the patient or the size of the patient also influences the dose to be administered. Now, these calculations are not hard, they're also easy, because how do we get the dosage to give the patient? Simply multiply the weight of the patient, multiply the dose given and the weight of the patient. As simple as that. Like you have this calculation, the required dosage is the dose per kilogram, which is given to you, mg per kg or mcg per kg, times the weight of the patient in kilogram. Now, after we have calculated that, then if you don't have the strength for the drug or for the dosage, that's when we go to reconstitution. I have this example here. It has two questions. The dose of the drug is 7.5 milligrams per kg body weight. If the patient weighs 60 kilograms, what's the dose to be administered? 1 kg body weight. This is a simple calculation. Always interpret this, that 1 kg body weight you get, and the patient gets 7.5 milligrams of the drug, but the patient is weighing 60 kilograms. So I will I will just do cross multiplication. 7.5 milligrams times 60 kg divided by 1 kg. So I will get the 450 milligrams mg of the or milligrams of the drug, as this kg and this kg goes away. Now, how does reconstitution come in? This question, from the above, if the drug to be used comes in or in stock, you have a 1 gram vial to be reconstituted with 10 ml of water for injection, what volume will be measured for administration to the patient? So from above, we have seen the dose is this, but we have a 1 gram vial where you have first converted to milligrams such that they are in the same units. So what does this mean? It means that 1000 milligrams of the drug will be in 10 mils of the solution. But for you, the patient is going to get 450 milligrams of the drug. What will be the volume that will be measured off with a syringe to administer to the patient? Just do the cross multiplication and then you get 4.5 mils. So 4.5 mils of the solution will contain 450 milligrams of the drug, and that will be administered to the patient. So this has been a short presentation. As always, we have more quizzes and then more questions to be attempted in our Go Classroom. Always follow the Go Classroom for more questions. I remain Wilson, your presenter. Thank you for listening to me.